Hi everybody, it's Carol Clark, your bariatric business coach, and this is another episode of Q&A with Carol. So I'm going to answer a question that I actually was asked 3 times this week, and that is it mandatory for nutritional products to be a part of your medical weight loss program? Occasionally I'll get it for surgical weight loss programs, but I get it more so for medical weight loss programs. And the answer is no, it's not necessary to have that as a required part of your program. In fact, you'll often attract people more so if at the beginning and they say, is this all about product? You actually say, no, you're welcome to use our products, or you don't have to use them at all. We can just teach you how to use whole foods, which is true. But by and large, as people get to know you and like you, and get to understand that you are there to help serve them, and you start to integrate some of the benefits of products, they actually will start to use them on their own and they'll integrate it into their nutritional plan. Some people aren't turned off by the product, but some people are because they don't want to use just products. So you also have to take some time when your person first comes in and you're meeting with them and you're telling them about all the wonderful things and the services that you have to offer. You want to make sure that you assess with them. Do you have a preference for utilizing product or not? And for some people, they actually would prefer to use product because it's less expensive in many cases. Not always, but in many cases. And it's also easy. If they work a lot of hours, it's something they can just take with them very quickly, and it helps keep them on track because they don't have to make decisions. If there's someone who likes to create their food, is good at meal prep and that sort of thing, then they may not want to use any of the nutritional products that you have. And as you know, that's very feasible. But at the very least, even if they're using just food, you should have vitamins in your retail store so that you are helping them augment to make sure as they're on their weight loss journey that they're getting the essential vitamins that you recommend. And of course, the most common ones that you hear that people recommend are a multivitamin, of course, B-complex vitamins, essential fatty acids, magnesium, potassium, and there's a handful of others. But you can put together what it is that you want to offer as your core vitamin package for your patients, depending on what your philosophy is and how your programs are set up. But the answer quickly is no, you don't have to mandate that product is a part of your programs. But when you're creating your programs, the good thing about products is it does oftentimes make weight loss results quicker. It does help ensure that they're getting the nutrients that they want and that they're using quality nutritional products with an adequate amount of protein and a controlled carbohydrate ratio, and one that matches your program. It helps also to take the guesswork out of what they should be eating. It's easy to put together a meal plan using all supplements or just partial supplements, and then moving them forward as they continue on their journey. And it also creates a method for engagement, which is great because it keeps them also coming back. Obviously, they're coming back for their consulting or their coaching or their accountability with you, but it helps keep them coming back for the products. And it also does add another revenue stream for your practice, but it's something that is easy to sell because it's very valuable. And for the patient, they end up, oftentimes, like I say, spending less there than they would somewhere else for their food or nutritional products. And they know that it's physician prescribed and that it's something that it will help them and also improves and makes their weight loss a little bit quicker. So that's my answer. I don't think you should make it mandatory, but I do think that you should have products that include you have some programs that can include all product that gradually weans them off, some that have both, and then some that are just totally whole food based. So that is my take on it. I do think retail sales is important in a practice, and it's not just about retail sales. It's really about helping your patient, and patients really do appreciate having the ease of having those products, and also, just not having to always be on fixing things. They like actually having products, and it also, like I say, increases that engagement, and it opens you up to the community to talk to more people about it. It also, with retail products, it gives you an opportunity to also have some sampling, to take that around to referring physicians, and you can just incorporate in so many ways in your practice. So that's my down and dirty answer with regards to, is it mandatory to have products in your programs. I hope you find this helpful. If you have a question that you want me to answer, Karol, Karol, at weightlosspracticebuilder.com. And if you're not a member of Bariatric Business Boss, hop on over bariatricbusinessboss.com and join me. Talk to you later. Take care. Bye.